Hi everyone, and welcome to this brief 20-minute introduction to the GP sessions in the conference week that isn't conference week, starting the 20th of June. I'm going to be talking to you about how you're going to be learning during your general practice rotations. What I'm planning to cover in this brief 20 minutes is an introduction to general practice, talk a little bit about what happens during your general practice rotation, what we expect you to learn, which is also very much what we'll be assessing both in the GP term and in later options for assessment that I'll mention later on in the presentation, and a brief introduction to what we're going to be doing during the face-to-face conference week sessions. So, general practice, we hope most of all that your general practice rotations are going to be a lot of fun, and we certainly get that feedback from other students both in rural locations and in urban locations. There's lots of good stuff happening in general practice that we think you're going to enjoy a lot. You'll be doing plenty of hands-on, and that's the push that we give you in general practice rotations. You're not going to be hanging to the back of a group, you're going to be one-on-one with the GP supervisor or other members of the general practice, and your best learning is going to be by doing stuff. Lots of learning opportunities, as you can see from the student comments related to each of these slides. All the components of the general practice curriculum that we have developed are designed to enhance your learning in this rotation. You may be doing some watching, and there's plenty to watch while you're in general practice, and some guidelines as to how you might get the most out of those less active learning moments. So there's no time in general practice when you can't be learning, whether you're hands-on doing or you're watching. There's also lots of opportunities for exploring your own learning, whether it's learning that's somewhat outside the curriculum or whether it's finding different add-ons to some of the curriculum learning. We're very keen that you develop your own learning plan, work out what's going to most advantage you to be learning during your general practice rotation. For those of you leading up to the barriers, you may find that you're a little bit exam directed in your learning. For those of you who undertake general practice closer to the end of 2017, when you're starting to think about how you're going to work in the hospital environment, and particularly in ED, which has quite a lot of similarities to the general practice setting, you may find that your learning's orientated to filling gaps that you're a bit concerned about at that stage of your training. Most of all, think about what you need to learn and make a plan for doing that. We provide back to base sessions in both the urban and the rural locations. They vary a little bit in the way they're taught across both those locations, and to some extent you're able to give input into that program also. Definitely worth attending. Good feedback from previous students on those sessions. There are a range of online resources, and you'll find them all posted on Views. Really important to access those. They'll help both with your assessment activities, the PBLAs I'll be talking about in a little while, and they'll provide some ready to access resources that will really enhance your learning in your general practice rotations. We know that you've undertaken a lot of learning across all the years of your course, and what we're wanting to do is to build on that learning, and as I said earlier on, perhaps to fill in some gaps where you feel you haven't quite got it all together. It's a busy rotation, and it's across a number of different sites with a range of different activities. We need you to be organised. We can't organise everybody's general practice rotation, and part of that organisation is getting in and reading the clinical attachment descriptor so you're really clear on what's expected right from the beginning, in fact before you start. We've arranged the learning in general practice to conform with the GP domains as set by the Royal Australian College of General Practitioners, and you'll see that there are 5 learning domains: communication skills and the doctor-patient relationship, applied professional knowledge and skills, population health and the context of general practice. This may be a new one for some of you, or not since MIC anyway. Professional and ethical roles, and GP roles are a little bit different to professional and ethical roles in other specialty areas, and the organisational and legal dimensions of general practice. We've set learning outcomes in each of those areas that are all detailed in your clinical attachment descriptor. So for communication skills and the doctor-patient relationship, we know you're good at patient-centred medicine. We want you to apply that in a context where you're seeing patients not just once or even for a brief period while they're hospitalised, but that ongoing relationship with patients that really enables you to broach sensitive topics and enables you to support and affirm patients in sometimes quite difficult circumstances. There'll be lots of opportunities for you to deliver patient education using appropriate jargon-free language like we know you can. Applied professional knowledge and skills. People say that the curriculum walks through your door in general practice, so there's a wide range of knowledge and skills that you can learn in general practice, and of course we want you to be able to undertake the initial assessment as well as to formulate diagnostic and management plans. We want you to think about what is going to be appropriate to general practice. There are some things that will be quite different to your hospital rotations. You'll have an opportunity to practice common clinical procedures, and we expect that it's not just walking in and doing the procedure, but thinking about whether this is the best approach, explaining results and ensuring that there's adequate follow-up of those procedures. We'll be wanting you to be able to demonstrate that you can manage not just conditions related to one body system, but chronic, complex, multi-morbidities across mental health and physical health. And we also want you at this stage of your training to be able to apply evidence, and not just to think about the textbook or journal-based evidence, but really to assess the applicability of that evidence to individual patients. In general practice, we're often managing uncertainty, and that's one of the key skills that we hope you will start to learn in general practice, how you manage that uncertainty. And similarly in general practice, you'll find that your GPs have a wide range of other specialists and allied health people that they refer their patients to, and some of your learning in general practice will relate to those referral networks. Under Domain 3, which is thinking more about the context of general practice and population health or public health type initiatives, we want you to be really clear on how general practice contributes to an effective health system. You've done some of this learning in earlier years. There'll be a little bit of revision in your conference week sessions, more in Year 5, but that is definitely accessible. That's one of the learning outcomes that we're really strong on in general practice, that you understand the importance of primary health care. We hope by the end of your general practice experience across both Year 3 and Year 5, and following some teaching in conference week, you'll be able to describe a diversity of roles of general practitioners, that you'll be able to think about the role of the GP in advocating for health and well-being, not just of individuals, but also of community groups, of populations, and particularly those that are high-risk populations, perhaps refugee populations, Aboriginal and Torres Strait Islander communities. We want you to be able to analyse epidemiological patterns, to be aware of the illnesses and the challenges in managing those illnesses that are particular to different communities, and to think about community-based responses. And of course, something that does distinguish general practice from other medical specialties is our role in preventive health. So we are looking for you to be able to describe preventive health activities across the lifespan. Under Domain 4, the professional and ethical role, we want you to use this general practice experience not just to become aware of areas of stress in clinical practice, and you probably will do over the course of your general practice rotation, but to look at what might be good strategies for managing those stresses, and not just in the doctor-patient consultation or even in the general practice, but thinking career-wide. And certainly in urban back-to-base sessions we cover that off, and look for those discussions in your rural rotations also. We want you to be able to think about potential role conflicts and professional boundary issues that might arise in general practice. It might be balancing the needs of an individual against those of the family and the community. It might be thinking about the conflict between advocacy for individual patients versus the role of the GP as gatekeeper of public resources. It might be in your relationships with commercial interests such as the pharmaceutical industry or other healthcare providers. It might be around safe prescribing of opioids and drugs of addiction, which is often a problem area, particularly for young doctors and often in the ED setting as well as in general practice. Most of all, in this general practice rotation, we want you to take the opportunity to reflect on your experiences, to identify your strengths, and also the skills and areas where you might need to put more work in. We want you to plan learning strategies and to carry out those learning strategies. And of course, you won't achieve everything you could possibly hope to learn in this general practice rotation, so we'd encourage you to think at the end of your general practice rotation where you next need to go in terms of your learning. And finally, Domain 5, the organisational and legal dimensions of general practice. You've been hearing about key principles of general practice. We particularly want you to be able to apply principles like whole person care, like continuity of care, both to individual patients and, as I said earlier on, to population groups with whom you'll be working. We want you to look at the GP systems in your practice, systems for ordering investigations and follow-up of abnormal results, and also referrals. We'd like you to be able to describe GP software and think about the pitfalls to avoid when you're using IT in clinical practice, and also to be able to explain the doctor's role and responsibilities in terms of common GP medico-legal issues. And you'll find we've got a fabulous session in Year 5 Conference Week on exactly that topic, covering issues like maintaining privacy and confidentiality, consent to medical treatment in certain groups such as adolescents, perhaps people with disabilities or mental illness, and sometimes the elderly, doctor's certificates and your legal responsibilities around those, as well as documentation of work cover and Centrelink and compensation cases. Assessment of fitness to drive can often be quite a challenging area in terms of those roles and responsibilities. And of course, mandatory reporting of suspected child abuse, infectious diseases and other public health concerns, all are challenging issues, and we want you to look at those and to learn about how GPs manage those while you're in your general practice rotation. We'll be expecting by the end of your rotation that you'll be able to describe the impact of organisational factors on clinical practice in the primary care setting. Factors like the practice population, the practice management and staffing, as well as health systems factors like financing and the different models of primary health care, ranging from the older traditional solo GP type models to the large multi-GP team-based care primary health care centres. You'll find details of the learning that we require under these domains in your clinical attachment descriptor. So the learning opportunities in general practice sounds like a lot to learn, but we provide a range of different opportunities. We ask that you complete a learning plan right at the outset of your general practice attachment, and it's good practice to revisit that throughout the course of your placement to see how you're going. You may want to add to that learning plan as you come across different challenging presentations that you realise you need to know more about, or perhaps the particular interest of your GP supervisor. We provide a learning checklist that's based on a GP registrar learning checklist that lists a range of common learning opportunities in general practice and things that are important to know that you can learn in general practice. Of course, the mainstay of your general practice learning is the experience that you have in your general practice, both with the GP, perhaps with GP registrars in the practice, and with other staff in the practice. This ranges between 2 and 4 days a week, depending on where you're placed, and it's mixed for some who choose to do so with Justice Health or aged care facility placements. We ask that you have 4 health professional visits. These are conducted a little bit differently across each of the sites in which you're undertaking your general practice rotations. So again, you need to read your clinical attachment descriptor and talk with those in rural areas who are helping you to arrange those health professional visits. For each of you, we ask that you undertake 4 mini CEXs, and we need you to succeed in those mini CEXs. If you're not successful the first time, we ask you to redo that, and we look for documentation of successful completion of those mini CEXs. And we also will be marking 3 practice-based learning assessments, 800 words assignments, and we set out 3 different groups. You're required to complete 1 PBLA from each of the 3 groups, and this actually counts for 50% of your summative assessment in your general practice rotation. And of course, as I've mentioned before, the back to base sessions provide learning that can be very flexible around your needs. In terms of assessment, there's quite a bit of documentation related to your general practice rotation. We require confirmation that you've attended those 4 health professional visits. We cite your learning plan. We also cite a GP supervisor signed completion of your 4 mini CEXs. And as I said, 3 PBLAs are marked by the general practice university-based team. The clinical attachment assessment form completed by your GP supervisor counts the other 50% of your summative assessment mark. Really important to get all this paperwork in on time. There's a couple of other forms we require, but these are the main assessment tasks that we take into consideration when we're giving you your final mark for the general practice rotation. And of course, approximately 20% of your Year 5 written examination questions will be situated in a general practice or community context. So, the logistics, how do you go about organising all this learning and ensuring that you've got all your assessment tasks on track? You'll find that the clinical attachment descriptor provides all this information. I've snipped some different parts just to show you. We provide a range of flow charts, handy tips, checklists, submission checklists, a draft schedule of activities, all sorts of useful information in that clinical attachment descriptor, so please take the time to read that. Check in with your GP supervisor at least a week ahead of time. They need to have your arrival confirmed, and you need to find out how to get there, what dress code they expect of you, what instruments you may need to bring with you. Plan your learning, as I said early on, right from the beginning of your attachment, and think about your health assessment, your health professional visits, and how they may fit in with your learning plan. For example, if you're wanting to learn about joint examination, you may plan a physio visit for your health professional visits. If you're feeling that your radiology needs a bit of brushing up, we're very happy for you to visit a radiology practice. So use those health professional visits to achieve some of your learning outcomes. Check your assessment tasks and plan those from early on. They're scheduled throughout your rotation. If you're late for your PBLAs, you will be docked marks for each day that you're late for those assignments, and we've had students fail general practice rotation on late submission. So please check the timeline for your assessments and don't lose marks for running late. Check your paperwork, make sure you've got everything on track, and submit all your forms, as I said. And most of all, make the most of all your learning opportunities in general practice. So our aim over general practice teaching you'll be participating in Years 4 and 5 are that you achieve an awareness of the importance of primary healthcare in the health system, that you have a good understanding of the variety of different GP roles, that you're able to apply GP learning in whatever setting you end up practicing medicine, and that you will be able to work effectively either as a GP or with GPs in the future. Contact details here, as also in your clinical attachment descriptor. So trick slide just to keep you on your toes. So when you come in on Monday the 20th of June, you'll be putting some of the learning that I've spoken about over the last 20 minutes or so into practice using a case-based approach. You'll be having a session on backs from an absolute expert in managing back pain. And you'll be having some practical hands-on sessions on managing wounds, on ENT examination and diagnosis, and also on sports medicine. On Wednesday the 22nd of June, we'll be talking more with you and actually putting into practice some of the GP consultation skills that are particular to general practice. Don't forget, there are 3 brief recorded more webinars than lectures for you to review before Wednesday. One of those is about transitions in healthcare and managing those transitions. The other is about GP consultation models, the extra things that you weave into your general practice consultations, and how you stage consultations over more than one visit, over often quite a long time period. And as I've mentioned earlier on, managing uncertainty is something that's very particular to general practice, and there are techniques that we'll be teaching and discussing on how to manage uncertainty. So I look forward to seeing you all on Monday morning the 20th of June, and we'll look forward to doing some hands-on with you and starting to provide an introduction to all the fun of general practice. Thanks for listening.